Yes, greetings to you, and hopefully you're doing well. The name is Robert Semwez Masaka, the director, HBMS TV Talking Health, a channel that was purposely started with the aim of health educating people to live a healthier life. And our major focus is the proper nutrition, health promotion, environmental conservation. Actually, we have a campaign that is going to be running in 2023 with the aim of conserving the environment, and our campaign is one vegetable per polythene. Everywhere you see a polythene, pick it, pack it with soil, and plant a vegetable for your own consumption. We will be expounding more about that. But we also have a sector for edutainment where we help educate people. And if you're out there and you need to learn through entertainment, HBMS TV is here for you. We have very many avenues where we promote health. So as we end 2022, we all know it has been a year of challenges here and there. I felt it important to share with you some medical condition that is challenging. But before I get into our topical discussion for today, I want to wish you a Merry Christmas and a prosperous New Year. And we wish you that whatever your wish is in 2023, it comes to pass. We encourage you to sit down and set goals for the year and then work towards them. So in today's show, I am here at Enro Hotel. Enro Hotel has preserved very many services for you on the 25th of December. So I'm here to let you know that on Sunday, the best place to be as a family is Enro Hotel. But for today, as we come to the end of the year, I want to discuss something very, very brief about sickle cell anemia. This topical discussion is already available on Tuesday and repeated on Friday to make sure that those who miss the live presentation on Tuesday can always have a repeat. So we are going to be discussing about life and sickle cell anemia, and just to give you an overview about sickle cell, it is just to do with abnormal red blood cells. I want to bring it to your notice. The red blood cells are usually round and flexible. That is the nature of red blood cells. And in sickle cell anemia, actually I want to tell you that some red blood cells look like sickles that are used for cutting wheat. Those curved knives, they call them sickles. So these unusually shaped cells give the disease its name. That is where the name sickle cell disease comes from. So you who is following us at HBMS TV, sickle cell anemia is one of the group of inherited disorders known as sickle cell disease. I want to tell you that it affects the shape of the red blood cells. Your blood cells are affected, which carry oxygen to all parts of the body. So what happens, the red blood cells are usually round and flexible for a normal human being. So they move with ease through the blood vessels. So in sickle cell anemia, some red blood cells are shaped like sickles or even the crescent moon that have curved moon. So these sickle cells also become rigid and sticky, which can slow or even block the blood flow. That is to do with the sickle cell. Actually, I want to tell you that there is no cure for most people with sickle cell anemia. You need to pick it from me. Actually, the treatment or the supportive treatment that is given can relieve the pain and even help prevent complications that are associated with the disease. So you is out there, how do you know? How do you get to know? How are these genes, the sickle cell genes, transmitted from one person to another? you need to know that either the father and the mother, they're either sicklers or they are carriers of the condition, that abnormal hemoglobin, that trait. So what happens is, if the mother is a sickler or is a carrier, and the father is a sickler or is a carrier, the moment they pass that abnormal gene to the child, each one of them, then the child is at risk of developing sickle cell. That is how it comes. Actually, if the parent is a carrier and the mother is a carrier and the father is a carrier, there are higher chances that 1 in 4, which is 25, the child can be normal. Then 1 in 4, that is around 25%, can completely be sick. But the bigger percentage, which is 2 out of 4, which is around 50%, the child can be a carrier. That is how it is transmitted. That is how somebody gets the genes. The parents must be carriers or sicklers. Now, what happens is this, that we have some symptoms. At times you can call them signs of sickle cell anemia. These signs specifically show from 6 months and onwards. Actually, what happens is that there are very many, but they vary. They are not that each and everyone should have these signs and that. So there is anemia. Obviously, you need to know that the normal red blood cells take 2 to 3 months to get before they are destroyed and they need replacement. But with the sickle cells, what happens? They break up or they get destroyed in 10 to 20 days. That is why these people end up getting episodes of anemia, because obviously the red blood cells are spoiled out. And now, the other one that you need to know, they are the episodes of pain, periodic episodes of extreme pain called the pain crisis. It so happens in sicklers. It is very, very common. Even some adults with sickle cell experience this again and again, and it is very painful. Actually, sickle cell can go as far as your nerves, as far as your bones, your joints, and then they are damaged, and then you keep experiencing the pain. Then the other one is the swelling of the hands and the feet. It is very common in sicklers simply because there is that blockage of the flow of blood to those extremities, and then there is that swelling. Then the other symptom or sign that you can look at is frequent infection, because the spleen is always affected, and the moment the spleen is affected, then your immunity has issues, so the infants keep becoming sick all the time. So as a mother who is out there, as part of preventive measures, you need to be in position to always assess the size of the child's spleen. So if there is that frequent infections all the time, then delayed growth and or delayed puberty. Simply because, remember, the moment the red blood cells are affected in one or the other, at the end of the day, nutrients, especially that promote growth, cannot be carried to all parts of the body, and that results into that problem. But more importantly, you also need to know that there is vision problem. There is a problem with these people having smaller blood vessels going to the eyes. What happens is that the moment these sickle cells block the blood vessels and all that, then somebody is going to have blood vision. So these are some of the signs and symptoms that I wanted us to discuss. But when to seek medical attention? When do you need to seek medical attention? You need to know that you see your healthcare provider right away if your child, or even you yourself, if the symptoms of sickle cell, the moment you see that you have signs of sickle cell anemia. Actually, when it comes to children, because children with sickle cell anemia are prone to infections, which actually often start with a fever, which is around, very high fevers, around 38.5 degrees Celsius, you need to run and seek medical attention or advice for them. Don't do self-medication in sickle cell. And you need to seek emergency care for symptoms of stroke, which may include, stroke is very common in sicklers. So these signs would include one-sided paralysis, or even the weakness in the face, or the arms, or even the legs. But you can also look at confusion there is difficult walking or talking, then sudden vision changes, then you can talk about unexplained numbness, then severe headache. All these are signs that would tell you that you need to seek medical advice. So basically, I also wanted to discuss once again, I earlier discussed about this, but I want to tell you the causes of sickle cell in details. So sickle cell anemia is caused by the change in the gene that tells the body to make the iron-rich compound in the red blood cells, which is called hemoglobin. So what happens? Hemoglobin enables the red blood cells to carry oxygen from the lungs throughout the body. So the moment the hemoglobin associated with sickle cell anemia, so what happens is the hemoglobin that is associated with sickle cell anemia causes the red blood cells to become rigged, sticky, and misshapened. So what happens? For a child to be affected, both the mother and father must carry one copy of the sickle cell gene. So if they are carrying two of them, that is where the problem begins from, also known as sickle cell trait. And they pass both the copies of sickle cell gene that is altered form to the child. So the child is going to become a sickler. And if only a parent passes the sickle cell gene to a child, that child will be a sickle cell trait or just a carrier. He does not become sick. So what happens is that as long as somebody is a carrier and then gets married to a carrier, then they can even give birth to a child who is a sickler. So what happens in the disease process, it all begins with the abnormal hemoglobin. When you talk about the abnormal hemoglobin, it results into sickling of the red blood cells. Then you're going to get rapid destruction of the sickled cells. Then there is clamping of cells and interference with blood circulation. Then there is correction of sickle cells in the spleen. Whatever this happens, whatever of the three, it will lead to something. You're going to find the skull deformation. You're going to find mental impairment. Then you're going to look at heart failure. You're going to look at rheumatism. You're going to look at abdominal pain, enlarged spleen. All these conditions happen in sicklers. And among the complications of sickle cell, to mention but a few, acute chest syndrome is very common, that chest pain. Then you can talk about the spleen sequestration, enlargement of the spleen and all that because of deposition of the red blood cells that are abnormal. Then you can talk about leg ulcers. You can talk about priapism. I'll expound more about priapism. These are painful erections in men who are sicklers, long-lasting but very painful. Then you can talk about leg ulcers. Then talk about deep vein thrombosis, even complications in pregnancy. As long as you're sickler, it so happens. So all those are complications. But the most important thing is the prevention of sickle cell disease. You who is following us at HBMS TV, you just need to subscribe to our channel such that you can learn more and more about several conditions. So when we talk about sickle cell prevention, I want to bring you to your notice that sickle cell disease cannot be prevented. Pick it from me. Actually, I want to tell you that diseases don't read books. Very many people think they've learned a lot and they can prevent sickle cell, but it cannot be prevented. If you carry the sickle cell trait, seeing a genetic counselor before trying to conceive can help you understand your risk of having a child. Here I'm talking to the mothers of a child with sickle cell anemia. A genetic counselor can also explain the possible supportive management and reproductive options to help you live a healthier life. And then you need to look at screening of HB. You screen for sickle cell, then parental diagnosis. You diagnose the parents whether they have or not. Then there is parental testing. All these things are helping you to be in position to prevent sickle cell and its complications. You get the point, eh? So now, roles of nutrition in sickle cell anemia. That is our area of focus. I need to explain a little bit about the nutrition, about how you're supposed to eat to live a healthier life as long as you have sickle cell. The role of nutrition is very important in the life of someone living with sickle cell. Many people with the condition, ask about the food that can help them live a healthier life. So you need to know that people living with sickle cell disease have an increased need for calories, micronutrients, especially the vitamins and minerals. Actually, a diet rich in fruits, vegetables, and essential nutrients and appropriate supplementation will be very good for sicklers. You need to consider that very, very much. You need to know that sickle cell, as you know, it is an inherited condition passed on from the parents, characterized by the lifelong anemia and painful crisis. So what you need to do, a good diet is of essence. It is very nice that is going to address the disorders of anemia and all that. So sometimes you find that we are too busy because of work. If a child is busy at school, so they need to eat, simply because being busy may make you forget about eating. So you need to be in position to eat appropriate nutrients. So eating good food will help in the time of crisis. So our suggestion as HBMS TV is this, that if you suffer from sickle cell, young or old, the best thing you can ever do for yourself is to eat well and regularly. So I'll be expounding on the foods that you need to eat. But before we even talk about the vitamin D that you need, we talk about vitamin C, we talk about folic acid, we talk about iron, you need to know some of the few things that you need to take serious. One, don't dare be dehydrated in your body. Always rehydrate your body. It is very vital. Don't expose yourself to extreme heat or coldness. Then the other one, you don't need to actually miss any vaccination. There now these days there are very many conditions that can be immunized. Go for that vaccine. They immunize you such that you can be in position to prevent the crises and all the problems. So you could do all this, but the problem still persists. That is the life of a sickler. Just know it so happens. But it is very important that you eat foods that would include liver. You look at P1G, that is pork. If it is okay for you, you can also do it. To the Muslim, dua with it. Then you can talk about chicken, then red lean meat, egg yolk. All these things are very nice. You can talk about fish. You can talk about beans, dates. You can talk about many forms of cashew, nuts. Then you can even talk about sweet potatoes. You can talk about tomatoes. You can talk about plenty of fruits and vegetables. It's very vital. Then other things you need to consider drinking or even eating. You can talk about oranges. They are very essential. They provide vitamin C. Then carrots, then apples, grapes, tomatoes. And you need to take plenty, actually a lot of pomegranate. It is a fruit that has seeds. It is very, very vital and will help you very well. But even dairy products are very good. But with a good nutrition and healthy lifestyle, we can assure you that you can live a crisis-free world. You don't experience crises and all that. Then you need to drink plenty of oil foods. You need to do a lot of things for you as a sickler to live a healthier life. You even need to eliminate stress. And on your screen, as you see, you can also look at the foods that are good in sickle cell anemia. Even if you're a carrier, you need these foods. You can talk about the nuts, you can talk about the blocker, you can talk about liver, you can talk about avocados. All these things that are rich in folic acid are very vital. The leafy greens are very vital. The asparagus, blocker, I have talked about that. Papaya, the pawpaw, then avocados, the seed nuts, blue cell. All these things are very, very vital. Okra, all these things, you need them to live a healthier life. Then vitamin C is also very vital. You know the sources. Then you can look at calcium. And all in all, that's what you need to do is a balanced diet. So the option is, if you can't afford those foods, we have what we call the well-balanced nutritional supplements for you. You return back to the person who could have shared with you this link. They will guide you accordingly. But you can look out for a product like a complete phyto energizer with 16,000 phytonutrients that you need in your body. Or you can even look out for C24/7. It is very, very vital. You can look out for Coledus, you can look out for Restore Life, you can look out for the Living Alkaline beverages, but for dosages, you just need to turn back to the person who could have shared with you this link, or you can even reach out to us and we'll guide you accordingly. But the way forward, as we come to the end of today's show, I want to let you know that living with the sickle cell is just like any other life, because it is not only sickle cell that takes people, but all you need to do is connect with other people, others like you, for support and answers to the questions about sickle cell disease. Then you need to join social clubs of people with the condition. Then you need to continue with the medical attention that is given to you from the hospital. But more importantly, enjoy life just like other people. Don't stress yourself about it. I've seen very many people living up to very, very old age, yet they're sicklers. So all you need to do is to take care of yourself. And I want to tell you that until next time, as a sickler, we wish you a happy new life, a happy healthy life without crisis. I want to tell you that we love you, and actually at HBMS TV Talking Health, we are here to help you. You can even go down there in the comment section and comment and make an inquiry. We will be in position to guide you. And once again, I want to wish you a Merry Christmas and a Happy New Year, that is 2023. But I can't forget to send greetings to our sponsor of these programs. And I want to send greetings to the Director, Mityana Institute of Nursing and Midwifery, Mr. Chint. Thank you very much for sponsoring these programs. But more importantly, I also want to send greetings to all our students from Mityana Institute of Nursing and Midwifery. And our other sponsor is Nasona Community Nursing Home, which is very, very sounding, and it can help you get medical services while you're at home. For those of you who are in Mityana, not forgetting the fraternity of Eno Hotel, Mityana. Thank you very much, and may God bless you. HBMS TV Talking Health. Merry Christmas and Happy New Year.